We are going to talk about personal protective equipment, their uses, and selection. Personal protective equipment are used to prevent blood, body fluids, and other infectious or potentially infectious materials from coming into contact with the body of healthcare staff, patients, relatives, and the community. There are different types of personal protective equipment. The use of each type depends on the task to be performed and the anticipated exposure. PPEs, what are they? PPEs are items used to prevent direct contact with infectious materials. It includes the hand, the body, the face, the head, and then the leg protections. The appropriate PPE must be used for the different procedure, as the consequences of non-use and wrong use can endanger one's life. PPEs are classified according to the parts of the body. The types of PPEs: gloves, aprons, gowns, coverall, face shield or goggles, caps, boots, shoe covers, and coats. Guidelines for using all types of gloves. Wear gloves as an additional measure, not as a substitute for hand hygiene. Wearing gloves is not required for routine care activities in which contact is limited to a patient's intact skin, except in the case of infection such as viral hemorrhagic fever. Wash hands before wearing gloves. Wear gloves on both hands before touching all patients' blood and body fluids, mucous membranes, or non-intact skin. Do not use gloves if they are peeling, cracked, or discolored, or if they have punctures, tears, or other forms of deterioration. Disinfect and remove gloves and wash hands immediately. If you come into direct contact with a patient's blood or secretions, even if the procedure is not completed, then put on a new pair of gloves and continue the procedure. Change or disinfect gloves immediately when a patient's blood or secretions come directly into contact with the hands inside the gloves, even if the procedure is not completed. Change gloves and wash hands in between patients. Never reuse disposable gloves. Remove gloves before leaving the examination or patient's room dirty, utility areas, or other work areas. Decontaminate all utility gloves before taking them off. Wash hands after removing any type of gloves. The hand protection, that is the gloves. Gloves are made from latex, vinyl, and nitrate. Can be powdered or non-powdered. There are three major types of gloves: sterile surgical gloves for sterile procedures, examination gloves for clean procedures. Utility or heavy-duty gloves are used for housekeeping activities, decontamination of instruments, washing of soiled linen, dusting, etc. The appropriate glove and size must be used for the right procedure. Steps for wearing gloves. Open the package containing the sterile gloves. Carefully open the inner wrapper, maintaining aseptic technique, being careful not to contaminate the gloves by touching them. Grasp the folded edges, inside surface of the dominant gloves cuff with the underhand and slip the dominant hand inside the gloves. To avoid contamination, the fingers of the other hand should touch only the inside of the glove. If the glove becomes contaminated, discard it and use a new one. Slip the fingers of your gloved hand under the cuff of the second glove. Insert the other hand into the glove and pull the glove on the dominant hand. Avoid touching your skin with the gloved hand Keep the thumb up and back. Adjust the glove so they fit properly. Make sure the gaps exist between your fingertips and the hands of the gloves. Inspect the gloves for tears before and during the procedure. Avoid allowing the outside surface of the gloves to come into contact with your skin, and do not let the gloves snap, as this may cause contamination or contaminants to splash into the eyes, the mouth, the skin, or other areas. Remove used gloves before touching anything. There are two schools of thought regarding the removal of gloves. Either of them is acceptable, so long as the principles are followed. Step 1. Grasp one of the gloves near the calf and pull its part off. The glove will turn inside out. It is important to keep the first glove partially on your hand before removing the second glove to protect you from touching the outside surface of either gloves with your bare hands. Step 2. Leaving the first glove over your fingers, grasp the second glove near the calf and pull it part of the way off. The glove will turn inside out. It is important to keep the second glove partially on your hand to protect you from touching the outer surface of the first glove with your bare hand. Step 3. Gently pull off the two gloves at the same time, being careful to touch only the inside surface of the gloves with your bare hands. Step 4. If the gloves are disposable or are not intact, dispose of them properly. If they are to be processed for reuse, example, industrial gloves, place them in a container of decontamination solution. Wash your hands immediately after the gloves are removed. Steps for removing sterile gloves. Second approach. Step 1. Pull one glove near you, your wrist, towards your fingertips until the glove folds cover. Carefully grab the fold and pull towards your fingertips. As you pull, you are turning the inside of the glove outwards. Step 3. Pull the fold until the glove is almost off. Step 4. To avoid contamination of your environment, continue to hold the removed gloves completely. Remove your hand from the glove. Step 6. Slide your finger from your glove free hand under the remaining glove and continue to slide your finger towards your fingertips until almost half of your finger is under the glove. Step 6. Turn your finger over and pull the gloves outwards and towards your fingertips. As you do this, the first glove will be encased in the second glove. The inside of the second glove will also be turned outwards. Step 7. Grab the gloves firmly by the uncontaminated surface, the side that was originally touching your hand. Release your grasp of the first glove you remove. Pull your second hand free from the gloves. Dispose of the gloves properly and wash your hands immediately. Rubber aprons. Aprons prevent infectious body fluids that may soak through clothes. This should be worn over outer garments. Must have hooks or ties that fasten around the neck. Must have ties at the waist that reach around the thigh at the back. Be long enough to cover the top of the boots and provide additional protection from spills running inside the boots. Gowns. Gowns should be made or lined with impervious material to protect all areas of exposed skin. Must be large enough to cover the entire clothing of personnel and protect all areas of exposed skin. Used to prevent soiling of clothing when taking care of patients. It's also used to prevent transmission of infection from clothing and body. When there is increased risk of exposure to blood and body fluids, Gowns are also used. Types of gowns. We have the surgical disposable gowns, surgical reusable gowns, which is made of cotton, and single-use disposable gowns. Now we'll take the single-use gowns. Single-use gowns should be worn only once and then discarded in appropriate receptacle or bin. In special cases, example, caring for patients with extreme burns or extensive wounds, sterile gowns should be worn. Let's take note of that. Gowns shall never be worn outside the actual work area. Wearing of single-use gowns. Select appropriate type and size. Opening may be in the back or front. Secure at neck and waist. How to remove. Unfasten ties. Peel gown away from neck and shoulder. Turn contaminated outside toward the inside. Fold or roll into a bundle and discard. Coverall. Coveralls are protective clothing used in the management of highly infectious cases. They must be worn by trained personnel to cover all areas of the body. Coverall often worn over scraps clothing to offer additional protection. It covers the entire body from the wrist to the ankles and sometimes comes with a hood as well. Face shields, goggles, or eye protection. It's worn whenever there is a likelihood of splashes, spray, splatter, or droplets of blood. Also for other potentially infectious material getting into the eyes, nose, mouth, or other facial areas. Goggles should be made of clear polycarbonate plastic with side and forehead shields. Goggles should be especially clear, anti-fogging, and distortion-free. Disposable goggles are preferred, but reusable ones can be used after proper processing or decontamination and cleaning. Position goggles over eyes and secure to the head using the earpiece or the hairband and adjust. Eye protection should be worn by securing it over the bridge of the nose and also over the mask. Wearing of goggles. Position goggles over eyes and secure to the head using the earpiece or hairband. Position face shield over the face and secure on the brow with the headband. Adjust to fit comfortably. Removal of goggles. Grasp ear or headpiece with ungloved or gloved hands. Lift away from face. Place in the designated receptacle for disinfecting or disposal. Face mask. Surgical masks protect the mucous membranes of the mouth and nose. Prevent droplet splashes and sprays from entering the mouth. Face masks must cover both the nose and the mouth and fit the face closely. Try not to touch the mask once it is secured on your face, as frequent handling may reduce its protection. Wash your hands before and after touching the mask. Surgical masks must cover both the nose and the mouth and fit the face closely. Let's take note of it. In special cases, a respirator, an example is the N95, must be used for infectious conditions. Wearing of face masks. Place over the nose, mouth, and chin. Fit flexible nose piece over nose bridge. Secure on the head with ties or elastic loops over the ears and adjust to fit. N95 or the respirator. N95 respirators and surgical masks are examples of personal protective equipment that are used to protect the wearer from airborne particles and from liquid contaminating the face. The Centers for Disease Control and Prevention, National Institute for Occupational Safety and Health, and the Occupational Safety and Health Administration also regulate N95 respirators. Wearing of respirator. Cup the respirator in your hand with the nose piece at your fingertips, allowing the headbands to hang freely. Position the respirator under your chin with the nose piece Pull the top strap over your head, resting it high at the back of your head. Pull the bottom strap over your head and position it around the neck below the ears. Place fingertips of both hands at the top of the metal nosepiece. Mold the nosepiece using 2 fingers of each hand to the shape of your nose. Pinching the nosepiece using 1 hand may result in less effective respirator performance. Cover the front of the respirator with both hands, being careful not to disturb the position of the respirator. To check for positive seal, exhale sharply. A positive pressure inside the respirator signifies no leakage. If leakage, adjust position, end, or tension straps. Retest the seal by repeating the steps until the respirator is sealed properly. To check for negative seal, inhale deeply. If no leakage, negative pressure will make respirator cling to your face. Leakage will result in less or negative pressure in the respirator due to air entering. Disposable caps. Disposable caps and reusable caps must be used when indicated. Example, operating theaters, isolation unit, etc. If disposable caps are not available, well-fitting cotton caps can be used. Leg protection. Wear leg protection whenever there is the potential of the legs coming into contact with blood, body fluids, or other contaminated materials. Examples of protections are boots, clogs, overshoots. Note, do not wear open shoes in procedure areas. Coats. Coats are used to protect clothing against biological or chemical spills and for body protection. Overalls protects you and your clothing from dust and other non-hazardous materials. It protects outer garments as and when indicated, especially when spraying, painting, and doing other messy jobs. The storage of PPEs. PPEs should be stored in a well-lit room, sorted by color and sizes. The room should be free from pests. If you want more information, refer to the manufacturer's guidelines. Thank you.